Hey guys, so we are finally in town. We decided that since we got in early, we were going to take a little side trip and decided to go to Santa Cruz and walked along the ocean for a minute as ocean therapy. It was actually really nice. I would recommend that if you are traveling for doctor's appointments or doctor's procedures, that you try to do something that isn't medically related while you're there, because a lot of your time and energy and money can be spent into going to these procedures, but then you're also only ever going out of town for procedures. So I think it's important to make sure that you have fun things to do, preferably before your patch, since you won't be doing much afterwards. But as you can see, I've taken a shower. I always take a shower before my procedure, the night before, because my hair is super thick and it will not be dry. And I don't want to be in the procedure room with wet hair. It would just drive me bananas. So I always take a shower beforehand. I usually set up everything so that I am ready to go in the morning, and it can be throw on your clothes, brush your teeth, and go, because especially with my particular doctor, a lot of times he squeezes in patients, or patients don't show up, or things get canceled. So even though we have a set check-in time, I always tend to plan to be there earlier than that. So my check-in time is going to be 8:30 in the morning, but I'm going to wake up extra early to make sure that we get there on time. Also, make sure that you plan for traffic. I know that it's going to be about half an hour from our hotel to the hospital. So that's something to keep in mind. Now, me personally, I have had small, what we think is allergic reactions to myself or one of the drugs that is used during the procedure. It's been known to look a lot like an MCAS reaction, but I don't have a MCAS or mast cell activation syndrome diagnosis. Having said that, I do tend to break out in a rash during these procedures, so I pre-medicate with 2 tablets of Benadryl 2 hours before my procedure time, and then I'm also medicated with Benadryl during the procedure. So this is what I plan on wearing tomorrow, and the way that I choose what I want to wear for my procedures is that I plan on where the procedure is going to be done. So since I know we're going to be working on my thoracic, I know that motions like this are going to be uncomfortable, so I chose something that was looser in the shoulders, something that could easily be pulled over my head. Another good option would be some kind of button down or a zip up jacket, which will also help with post-operative discomfort. So since I've done this a few times, my traveler and I, no matter who it is, we usually tend to have some level of routine. And I think that that routine makes it a little less scary, a little less nerve-wracking, and that routine is something you can kind of count on. So usually when we arrive in town, we get the hotel, we go to one of my favorite places to go, which is either P.F. Chang's or Spaghetti Factory, because those are my splurge, oh my gosh, I never get this kind of foods. And so it's a little bit of a treat. And then usually we come back to the hotel and watch Food Network, because that's my guilty pleasure. And by doing that, it kind of sets a rhythm, kind of relaxes you, makes it feel not so scary, especially if you've done this, if you're doing this for the first time, or you still get jitters beforehand. Since I've had this procedure multiple times at this point, this should be, I think, my 18th procedure, I don't get kind of the new patient jitters about this procedure anymore, and I have absolute 100% faith in my doctor. I still get nervous just a little bit because it is still technically a same-day surgery kind of procedure, especially with mine, because since it's thoracic, they have to use fluoroscopy in order to kind of see where they're going. But overall, I'm usually pretty calm. And the fact that I do pre-medicate with Benadryl means usually I am falling asleep in the pre-op area, because you obviously can't have allergies if you're in a coma, which really should be the name of Benadryl. But at the point that we go to bed, I set an alarm as well as my traveler because I'm always paranoid about being late. We always check to make sure what our travel time is going to be and add a little bit of time for things like traffic, parking, walking to the building, all that stuff. At the point that I get there, we usually check in with a desk clerk. They make sure that all of my medications are up to date. They give me my wristbands. At that point, we go to a waiting area where I'm called and I get my vitals taken, I get my weight taken, and then at that point I go to a pre-op procedure, which is this big room with lots of beds that are separated by curtains, so there's not a ton of privacy, but the idea is there. At this point, I usually am told to get out of my clothes and put them in my belongings bag. At that point, I put on my gown and my little hair cap. It's always fabulous looking, and I have more than one selfie in it. At that point, once you're dressed, the curtain is pulled and they ask a lot of the same questions that they do for every procedure. Have you traveled outside of the country? Are you having any kind of illness type symptoms such as cough, fever, any sign of infection? And then more questions along those lines. At the point that they've checked you in and they've done all of the pre-op questions, usually the doctor, my doctor, comes in and verifies what we're going to be doing as well as where it's going to be done, and then he'll actually sign the area of which we're actually going to be targeting. So usually we're somewhere between T5 and T8, so usually he'll sign where he plans to go. And then you also sign a paper basically saying you understand what's going to be done, where it's going to be done. And then just as a side note, they usually have a list of any belongings you have. I would recommend not bringing more belongings that you care about than is recommended. Like any other surgical procedure, it's no metal, no earrings, no necklaces, any of that. At the point that all of the pre-op has been done and I've spoken to the doctor, we understand what we're doing, where we're going to do it. Usually the anesthesiologist comes and talks to me, introduces themselves to me. Something I mention is that I am a sensitive soul, and I apparently also have sensitive veins, according to someone who has done this procedure on me before. But I tend to be really sensitive to medication. I tend to react in some way, shape, or form, even if it's not allergic. So for me, if someone presses IV Benadryl too fast, it can tend to burn. So if you're not aware of that, just be aware. It's nothing too bad and it goes away after a minute. But if you feel that, or if you feel a chest tightening sensation, that's just because they are pushing the Benadryl too fast. If that's the case, definitely speak up, say, hey, like, what did you give me? And whatever you're doing, can you please slow down how fast you're giving it to me? So usually, because I'm aware of this fact that I am sensitive to these medications, I'll usually say, hello, nice to meet you, to my anesthesiologist. And then I mention to them, hey, I'm sensitive about things like IV Benadryl and any kind of IV pain medication. So if you'd please make sure that you press everything really slow, I'd appreciate it. And especially with these procedures, communication is key. The more you communicate, the better off you'll be and they will be. Usually at this point, they say, are you ready to go? I say, yes, I'm ready to go. And then you either walk into the OR or get wheeled, and things will be different depending on which hospital you're at. This is just my personal experience with Stanford, and this is how my doctor does it. Every doctor will probably be slightly different, so don't be alarmed if your experience isn't exactly like mine. At this point, usually I'm wheeled in, and usually the doctor has some kind of music playing. Mine likes to play like hairband music, which I absolutely love. And I actually like it because it kind of puts me at ease, because you have to remember that these people do this all day long. It's their job and they enjoy their job. So music for me is fairly relaxing because it feels a little less sterile, and it's more of like a hangout, if that makes any sense. But usually with these procedures, they'll have something like a massage table where they have a hole for your face. So at this point, this is where it can kind of deviate. If I'm having a blood patch, because my veins are not good on my left arm. I have a tendon running over it and they're pretty much useless. And because I only have one usable arm, something that's really important is that they want a clean blood source and a medication source. So usually my medication is given to me in my arm, but in order to get a clean blood source, because my left arm isn't usable, my doctor likes to put my blood source in my neck. And I actually made a mistake in a previous video by calling it an IJ, which is an internal jugular, but this one is actually external, so it's an EJ. But that's usually what I have done when I have a blood patch. And usually what that entails is that they tilt the table and they tell you to bear down like you're having a bowel movement, or you're holding and pressing down. And that bulges the veins in your neck, so they're easier targets. My doctor is an absolute whiz kid at it. He can get it done super fast, and usually what happens is they give you a little bit of lidocaine to kind of numb it up, and then they put in the catheter, and voila, you're done. And then at that point, they have you flip over, so you go from one bed that you came in on, and then they have you crawl over to the massage table with your face down in the hole, and make sure you do all the adjustments that you want in order to make sure you're most comfortable. Depending on where they're going to be targeting, they may have pillows in certain areas to open things up and make sure that they have as much room as possible. If I'm just doing fibrin, that EJ step is skipped, so I just go straight from the table to the other table. At this point, they usually hook me up to monitoring so that they can monitor my vitals while they're doing the procedure. And they usually put oxygen in my nose and make sure I'm really comfortable. At this point, they usually tuck in my arms so that they're nice and secure. And then the doctor starts giving orders to all of his coworkers. My doctor is excellent when it comes to communication during these procedures. I have absolute confidence. I know what they're doing because he is very specific. Raise the head of the bed 25 degrees. Do this just a certain way. Lie it just here. He makes sure that everyone knows exactly what they're doing, when they're doing it, how they're doing it, how much they're giving, everything. So he'll usually rattle off what medications to give me, sometimes in what order, and definitely in what dosage. He usually gives some kind of summary. You know, this is Linnea, she's got this, she has these allergies. He makes sure everyone is on the same page. At this point, this is where things get a little fuzzy because it's considered somewhat of a conscious sedation kind of procedure. I don't know exactly how this goes with other hospitals. I am only giving you my experience. But with these procedures, they usually give me some kind of antibiotic to avoid infection, Benadryl to stave off any kind of reaction or rash. They also give me Versed for relaxation purposes, and propofol, which is considered a kind of sedation type drug medication. So I'm aware of what's going on, but things start to get a little fuzzy. If someone asks me a question, I can respond, but otherwise I'm kind of Twilight Zone-y. I'm there, but I'm not truly all there. But they do this to ensure that everything is kosher. They need to make sure that they can talk to you and you can talk back to them to make sure that everything is correct. If you experience pain, they can have you communicate, ow, that still hurts, and be able to give you more pain medication. Depending on what they're doing, how much they're doing, and where they're doing, the procedure time is going to vary. How long would you say mine are usually?
Generally between 40 minutes, 45 minutes.
45 minutes. And a lot of that sometimes is prep work, such as putting in that EJ. And my doctor is super careful that when he's doing something correct and the first time. But he also uses fluoroscopy since it is in the thoracic area and you do have a lot of important stuff in there. But they use that in order to make sure they're going exactly where they're supposed to so that they avoid poking anything that's, important. At the point that we're done, me being in my kind of twilight sleep, I'm there but I'm not there, kind of pull out of it. They say, hey, Linnea, you're done. And so I go, okay, cool deal, and get back onto my bed, and they wheel me off to the recovery room. If you have a blood patch, according to Stanford, according to my doctor, I am lying flat without a pillow for 2 hours in the hospital. At this point, I get a x-ray done of my chest because this is a thoracic procedure. And this x-ray ensures that they haven't poked anything important or given me what's called a pneumothorax, which is a hole in the lung that can cause it to collapse. This is a rare thing that can happen, but it is something that happens on rare occasion. Because of this, they do this x-ray. The x-ray will indicate if there is any kind of air that's trapped in your lung, to which they can either monitor it if it's very small, because a lot of times it'll resolve on its own, or they can deal with it further. It is very rare, but my doctor is super good and I have complete faith in him. When I first started these procedures, that fear was stronger because I wasn't so familiar with my doctor, and the idea is pretty scary, but the idea is to keep open communication with your doctor. And I think that having that faith and that good relationship with them makes it not so scary. If you've had a fibrin patch, according to Stanford, according to my doctor, you only have to lie down for 1 hour without a pillow. At that point, again, you get your x-ray. If you get a good bill of health, you get to go home. Each hospital is different. I've heard a lot of different things when it comes to blood patches and fibrin patches, as far as how long you're supposed to stay down in the hospital and how long you're supposed to stay down at home. I've heard 24 hours from a hospital, 72 hours from a hospital, 48 hours. It's all over the place, and everyone has a different idea of how long is long enough for these patches. For Stanford, their golden rule is 72 hours, 3 days, lying flat, no pillow. Hard to do. And when I say no pillow, when you're lying on your back, you want to be as straight as possible, because the more you tilt, the more pressure. If you think of your spine like a hose, you have the hose that has an equal level of pressure of water in the hose. If your head goes up, it starts to have more pressure of water down at the bottom. So if you've had a patch down at the lower part of your back, you're putting more pressure on that brand new patch. So on your back, I recommend no pillow. Having said that, if you're lying on your side, having a pillow, you can still keep your head straight with the rest of your body, so that's totally fine. I even struggle with the whole being on your back with no pillow thing. I totally get you, but I don't recommend it. If you've seen other videos with my head on a pillow on my back, my bad. So, as far as staying down for 72 hours, that means bed rest for 72 hours unless you have to pee, pretty much. So get comfortable. That means comfortable clothes, comfortable bed. Make sure that you have everything you need in order to be comfortable and entertained. Get the Netflix, get the iPad, all the things. Get a book, I don't care, sleep the whole 3 days, which you will probably do. Because of these procedures, I myself tend to sleep a lot the first day.
working on waking up so I can put some clothes on, and then we're going to go back to the hotel, eat good food, and sleep.
Hey guys, so we have left the hospital and we are currently, I'm lying down in the back of my car and my mom is going in a spaghetti factory to get us food. And that's kind of where we're at. I am so tired, oh my gosh. I'm having such a hard time waking up. But I didn't fall asleep until 2 and then my alarm went off at 7, so I imagine the short night doesn't help. I just want to give you guys an update. My injection sites so far don't hurt at all. And my neck pain isn't as bad as it was before. I'm just super sleepy. But that's what I have.